Most people believe that knee pain after 50 is a one-way road, that once the cartilage wears down and the joints start aching, all you can do is rely on painkillers, injections, or eventually surgery. But what if I told you that one of Japan's oldest practicing doctors, a man who treated patients well into his 90s, said the exact opposite? He believed that knee pain is not mainly a joint problem at all, but a movement problem, and that for most people, especially those over 50, just a small set of very specific exercises can dramatically reduce pain and restore function if they're done the right way. So before you give up on your knees, before you accept stiffness, swelling, and pain as your new normal, stay with me because what you're about to hear may completely change how you think about your knees and your body. The Japanese medical philosophy, especially among older physicians, has always been slightly different from the Western approach. Instead of immediately focusing on the damaged structure, they focus on how the body is being used every single day. This doctor explained that the knee is a victim joint. It rarely fails on its own. It suffers because of what's happening above it and below it, because of weak hips, inactive thigh muscles, stiff ankles, poor circulation, and years of repetitive, unnatural movement like sitting for long hours. By the time pain shows up, the problem has usually been developing quietly for decades. The good news is that this also means the knee can recover, not overnight, not magically, but steadily and safely, if you restore the movements it was designed to do. One of the biggest mistakes people over 50 make is trying to strengthen the knee directly with aggressive movements, heavy machines, or deep squats before the joint is ready. This often makes the pain worse. The Japanese approach is gentler but smarter. It starts by reawakening muscles that have gone dormant and improving blood flow to the joint. Healthy cartilage doesn't have its own blood supply. It depends on movement to bring in nutrients and remove waste. That means motion, not rest, is what keeps knees alive. But it must be the right kind of motion. The first exercise this doctor emphasized is something almost embarrassingly simple, yet incredibly powerful when done daily. It's controlled knee extension while seated. You sit on a chair with your back straight, feet flat on the floor. Slowly extend one leg until it's straight, gently tightening the muscles on the front of your thigh, then slowly lower it back down. There's no swinging, no jerking, no rushing. This movement wakes up the quadriceps, which act like natural shock absorbers for the knee. When these muscles are weak, every step sends more force directly into the joint surfaces. By restoring strength here, you're unloading the knee. Many patients reported that within a few weeks, everyday activities like standing up from a chair or climbing stairs became noticeably easier. What makes this exercise so effective is not intensity but consistency. The doctor often said that muscles over 50 respond better to frequent, low-stress activation than to occasional hard workouts. You're teaching the nervous system to trust the movement again. Pain often causes the brain to shut down muscles as a protective response. Gentle, repeated motion tells the brain that the knee is safe, and this alone can reduce pain. The second exercise focuses on the back of the leg, an area many people completely ignore. Tight or weak hamstrings change how the knee tracks during movement, increasing strain on the joint. This exercise is a gentle standing hamstring activation. You stand holding onto a chair or wall for balance. Bend one knee slightly and bring your heel back as if you're trying to touch your butt, but only as far as comfortable. You pause briefly, feeling the muscles at the back of your thigh engage, then slowly lower the foot back down. This helps rebalance the forces around the knee. When the front and back of the thigh work together, the joint moves more smoothly, with less friction and less irritation. An important principle the doctor taught was to never chase pain. Mild muscle effort is good. Sharp joint pain is not. If an exercise hurts inside the knee, you reduce the range of motion or slow it down. Over time, the range naturally increases as the joint becomes healthier. This patient-first, pain-respecting approach is one reason his methods were so effective even in very old adults. The third exercise shifts attention to an area most people never associate with knee pain at all: the hips. Weak hip muscles, especially the muscles on the side of the hips, allow the knee to collapse inward with each step. This increases wear on the inner knee and is a common cause of arthritis pain. The exercise itself is a simple side leg raise. You lie on your side or stand holding a wall and slowly lift the top leg out to the side without twisting your body. The movement is small, controlled, and deliberate. You should feel it in the side of your hip, not your lower back. Strengthening this area realigns how the leg moves, taking stress off the knee every time you walk. The doctor often said that if your hips are strong, your knees will thank you for decades. He saw patients in their 70s and 80s who had severe knee pain, yet after a few months of consistent hip strengthening, they were walking comfortably again, sometimes for the first time in years. This is a perfect example of treating the cause, not just the symptom. The fourth exercise is about circulation and joint lubrication. It's gentle ankle pumping. You sit or lie down and slowly move your feet up and down, pointing your toes away and then pulling them toward you. This movement improves blood flow through the lower leg and into the knee area. Poor circulation slows healing and increases stiffness, especially in the morning. By improving flow, you reduce swelling and bring nutrients to the joint. Many people underestimate how much ankle mobility affects the knee. When the ankle is stiff, the knee has to compensate, and that extra stress adds up over time. This exercise is especially helpful first thing in the morning or after long periods of sitting. The doctor recommended it frequently to older patients who complained of rusty knees when they got out of bed. Within minutes, the joint often felt warmer, looser, and less painful. The fifth and final exercise ties everything together. It's controlled sit-to-stand movement. Instead of avoiding chairs because standing hurts, this exercise turns a daily activity into therapy. You sit on a chair, feet shoulder-width apart, lean slightly forward from the hips, and stand up slowly using your legs, not your hands if possible. Then you slowly sit back down. This trains the entire chain, hips, thighs, knees, and ankles, in a natural, functional pattern. It teaches your body how to handle load safely again. What makes this movement so powerful is that it directly translates to real life. Getting up from a chair, a toilet, or a car is something you do every day. When you practice it with control and awareness, you build confidence as well as strength. Fear of movement is a major driver of chronic pain. When people regain confidence, pain often decreases even faster. Now, it's important to talk about what not to do. One of the biggest mistakes is doing too much too soon. More is not better. The doctor believed in daily practice, but in small doses. 5 to 10 minutes, once or twice a day, was often enough to create change. Another mistake is ignoring posture and breathing. Holding your breath or tensing your shoulders while exercising increases overall tension and can actually worsen pain. Slow breathing tells the nervous system to relax, allowing muscles to work more efficiently. Footwear also matters. Shoes that are too soft or worn out can destabilize the knee. The doctor often advised simple, supportive shoes that allow natural foot movement. And finally, he warned against complete rest. While rest is necessary during acute inflammation, long-term inactivity weakens the muscles that protect the knee, creating a cycle of pain and decline. One of the most inspiring aspects of this doctor's work was his belief in the body's ability to adapt at any age. He treated people in their 80s who thought it was too late. He would smile and say, "Your knees don't know how old you are. They only know how you move." That mindset alone changed how patients approached their health. Instead of feeling broken, they felt capable again. Consistency is the real secret. These exercises are not exciting. They don't promise overnight miracles, but done daily with patience and respect for your body, they can restore strength, improve alignment, increase circulation, and most importantly, reduce pain. Many people found that after a few months, they no longer thought about their knees all day. They could walk, climb stairs, and enjoy life again without constant discomfort. So if you're over 50 and dealing with knee pain, remember this. Your knees are not fragile glass waiting to shatter. They are living joints designed to move. With the right movements, done the right way, they can become stronger, not weaker as you age. Start gently, stay consistent, and let your body relearn what it was built to do. To wrap this up, knee pain after 50 is often the result of weak muscles, poor movement patterns, and reduced circulation, not just wear and tear. By practicing a small set of gentle, targeted exercises consistently, you can reduce pain and improve function over time. If you found this information valuable, make sure to subscribe to the channel, like this video, and let me know in the comments what topic you want to see next.